Hello.
Hi, Dylan.
Hey, how's it going?
Good, thanks. How are you?
I'm doing excellent. Can you hear me all right?
I can hear you great.
Good.
Perfect. So we'll just start in 1 minute. I'm just going to go. So we're going to have about 15 minutes, and I'm just going to do a quick introduction and a few housekeeping things, and then I'll pass it off to you to kind of do a short introduction, and then we'll get the questions rolling.
Great.
Perfect. You should be able to see the chat because you're not sharing a screen, so that should be up.
Cool. Yeah, I got two chats. I got a question and answer and then just a regular chat.
Yeah, so they might pop up in both. Perfect. So thanks so much, everyone, for joining. We are going to get started. Unfortunately, so we were supposed to have a medicine and a dentistry student attending, and our dentistry student was going to be taking a break from his clinicals. Unfortunately, has had an emergency patient, so he might be a little bit late. We're hoping he's going to be able to attend, but if not, we do have our awesome medicine student here, Dylan Steinke, who's currently studying at the University of Queensland in his third year as an MD student. So I'll let you take the floor and welcome.
Hello, everyone. So I'm Dylan. I'm currently working at the Redcliffe Hospital for my fourth year of medical school. I've been in Brisbane for the first two, and then now Redcliffe is like just slightly north of Brisbane. Been hanging there closer to the beach. Loving every bit of it so far. So if you have any questions, just check them in the side. And so right off the bat, experience of connecting with others, making friends. So I'm not sure about dentistry, but how medicine works is they put you in groups of 10. And you meet with these groups of 10 for anatomy tutorials, pathology tutorials. You do cases together. So they'll give you a case like, patient comes in with like X symptoms and you kind of play through it. And you do that in your group of 10. So this is your friend group. And it kind of like forces you to be friends with these people. Now, others made friends outside their group. I didn't. I just kind of stuck with this 10. Three of them are awesome and three of them are pretty okay, and four of them sucked. And that was kind of good enough for us to be friends. However, the mistake that I made is after year 2, we don't do case-based learning anymore. And then my friends that were in my first two groups were Americans, and the Americans at UQ only stay for 2 years. So then they went home afterwards. So like I just lost all my friends in second year. UQ still hosts lots of events to try and like help you meet friends. However, because now I'm in Redcliffe, I can't make those. So my friend group has actually been just through sports. Like I play ice hockey here. For any of you Canadians that want to keep playing ice hockey, there's lots of teams. So I've been playing hockey, and my friend group has been not medicine anymore. So that's been kind of how I met friends. But lots of opportunities. There's really no excuse for you to like not have friends. They really force that on you. So cool. Do I plan on returning to Canada? I'm going to apply to Australian internship. For those that know, that's just like the first year of medical school afterwards. And then from there, make a decision if I'm going to go back or not. Australian interns get paid more for less hours, but it doesn't really advance your career as much as a Canadian residency would. Canadian residency is only a couple of years. Australian residency is a lot of years. So I'm going to do one for sure, just kind of got a hold of my loan, but I know lots of people are going back to Canada on the first try. What are PBLs really like? Oh, that's a good question. So these, we go CBLs, PBLs, whatever school you call them are different. You get with your group of 10. It's kind of almost like Dungeons and Dragons. If you've ever played or seen, it's doctor presents a patient to you. Patient arrives with vomiting, nausea, epigastric pain for 3 weeks, presents with his mom, blah, blah, blah. And what do you want to do? And then, someone will say, oh, let's do a full blood count. Then she'll say, okay, full blood count shows blah, blah, blah. So it can be super helpful if you kind of like that role play part of school. It's good for learning. However, it is just 3 hours on one patient. So sometimes it kind of drags out. So there's definitely goods and bad. Really try and make the most out of your PBL for if you can, because if you can learn from it, you'll have a lot of fun, and it goes really quickly. But if you have a bad group and everyone's kind of like putting zero effort in, then it's a really painful 3 hours. Where did you do my undergrad? I did my undergrad at the University of Lethbridge. I chose Australia for medicine because I didn't get in Canada. However, the caveat for that is, I don't regret that. Like I only applied once, and I had the scores to probably get in if I gave it 2-3 years of applying to Canada. But I just didn't want to wait. Went to school, applied to Australia through OzTREKK, which takes like 2 seconds. So it was almost kind of like a, oh, whoops, accidentally applied. And yeah, just got in and went to it, and like I loved it immediately. A lot of people will keep applying to Canadian schools in their first year of Australian med school, and then they'll just bail out if they get in. And I didn't do that just because my first semester was a lot of fun. I had a few friends that left though. How you describe post-secondary education experience? It's exactly like the University of Lethbridge. I mean, it's hard to compare because I've only been to 2 universities, but UQ is just like the U of L. There's crap classes, good teachers, bad teachers. Campus is beautiful. I don't spend a lot of time on campus, but from what I can tell, the idea of the university is exactly the same as my Canadian experience. How was I able to fund my med school education? I have 3 loans. So I have a student loan from the government for $160,000. This loan, I don't have to pay back until I have a job or making $25,000 or something like that. And there's no interest up till this point. So that's like the awesome loan. Then I have another loan from TD Bank, which has been nothing but nightmares. It's just been really hard to communicate them from Australia, but that loan's for 400 grand. I've only used like 90 of that so far, but just I got approved for 400. That one I got approved for essentially within minutes, which was really cool. So that could have funded the entire thing. However, I do pay interest the second I take things out. So I pay about, on my 90,000, I pay about $200 in interest every month. So that's not great. And then I also was fortunate enough to have a small loan from my parents of 50,000 that I'm paying no interest on, but I'm going to pay them back as soon as I have a job. I know that's not the option for everyone, but if you are in like a I have no money situation, this still is doable. If you start next year, you'll probably end up paying, like I had a total loan of 400 grand or total tuition of $400,000. No, $300,000, $100,000 living, 400 total. You'll probably be a little higher than that because tuition goes up all the time, but it's still very doable, even if you don't have like, a rich family or whatnot. Hope that makes sense for loans, because I know loans is a big thing for you guys. Not that hard to get though. Like you just have to apply to like, a few different banks, as long as you don't have terrible credit, I guess. But I had no credit, and it was all right for me. The environment learning. The cool thing about UQ is everything's recorded. The question was just environment learning. Everything's recorded, so I did a lot of stuff studying at home in my pajamas, saves having to go to the bus. However, the University of Queensland is probably the nicest campus I've ever seen in my life. It's just incredible. Like it's nicer than, well, it's very similar to UBC, but like, nicer than Lethbridge for sure, nicer than like Saskatoon and Edmonton and Calgary and all that. So it's just incredible place to study if you want to, but it's really busy. So for myself, getting there wasn't always an option. Main pros and cons of Australia versus Canada. The weather is so much better here. I haven't shoveled snow in 4 years, and I'm so happy about it every day. My brother will send me a message of like a picture of the front driveway, and it'll be like 3 feet of snow, and it's just horrible looking. And I'm so excited that I have none of that. There's no leaves to rake in the fall because there's no fall. There's hot and there's less hot. I'm at the beaches all the time. I go to the beach probably 3 times a week because I live kind of closer to one. It's just a way more laid back community. Like I just feel like that like work till you die culture just isn't quite there like it is in Canada. So those, I mean, the pros are kind of like much based around like the tourism aspect. I do all the cool tourist stuff. With the pros, it's a little more expensive cost of living, not like crazy more expensive. But I definitely noticed certain things like, if you want a coffee, like it's hard to get a coffee from a store for less than $4. Gas is $1.40 a liter, and I spent $10,000 on a car that's probably worth $2,000 back in Canada. So it is a little more expensive. The people aren't quite as nice. People are still very nice, but there's none of that like absurd nice, like holding the door from 30 meters away or whatnot that are in Canada. So that just some of the social interactions have been a little weird. But ultimately, I got very few complaints with coming to with Australia in general. However, with that being said, I'm from Alberta. That could be, you could have very different experiences from, differences between Ontario or Newfoundland or wherever you guys are from.
I'm actually just going to jump in for a minute. We have two more people that have joined us. So Alexa's just joined. She's our dentistry admissions officer. And Tyler has also been able to take a break here from his clinical. So you can pop off mute, Tyler. And I'll give you just a minute to introduce yourselves. And if it's easier from now, I might just read the questions out loud so that you can both have a chance to answer.
Yeah, sounds good.
Hi there, sorry for being late. I was just running late with a patient. My name's Tyler. I'm a fourth year dental student from the University of Sydney, and it's a pleasure to join you tonight.
Thanks so much for taking the time. Obviously, you're at work right now, which is pretty cool too. So thanks so much. So yeah, I'll jump right back into questions. We've got lots coming in, which is great. So talking a little bit about rotations and kind of maybe what that experience is like, any rotations at home and any kind of your clinical experiences for both of you.
You're welcome to go first if you'd like. It doesn't matter.
Sure.
Oh, go for it. Be my guest.
Okay. The rotations are really cool. I was just at the emergency room the last week, which was the first time that I actually got to play doctor. I showed up, 7 a.m. or whatever, and they handed me a chart and said, "Hey, welcome new med student. That's your patient. Deal with it." And it, I actually got to like see this, I'm sick, please help me. It was really cool. But before that, you kind of just follow around doctors, and as they do their job, which can be either really good or really bad, you get to see some really crazy things, patients with, abscesses the size of another head, and people about to die and whatnot. There's all these like awesome, interesting things. Not necessarily the best for learning per se. So you really have to balance seeing real things and like learning how the hospital works and your study at home. Just because there's not like a ton you can learn from watching a doctor do paperwork for the 45 minutes after they saw that really cool patient for 15 minutes. So.
Perfect. Tyler, did you have anything to add?
I haven't been on rural rotation yet, but the experience is fantastic from what I've heard. You get a lot of experience clinically, seeing different kind of patients, and just having a chance to kind of work on your own at your own pace, and just putting your skills to practice. So rural rotation doesn't occur until fourth year out of the 4-year program. So it between the months of about March up until November, there's about 5 or 6 different groups, and you're kind of just scattered in throughout. And there's beautiful places you can visit, like the North Shores of New South Wales, Ballina, if you've heard of it, Broken Hill, a few other places that are really scenic, very beautiful beaches. It's almost like a getaway from what I've heard, but I haven't been yet, so can't comment too much.
Great. So another question for both of you. So it's about navigating international student housing. So how did you kind of navigate that, and what type of accommodations did you both choose?
So housing was a nightmare for myself. I have a partner and a dog. So because of that, I didn't want any roommates. So I had to find something that was kind of on the cheaper side that we could live on ourselves and that allowed dogs. There is lots of options, but I ended up applying for about 40 houses before I got accepted for one. People that I know without animals had a little more luck. They had to apply for about 15 or so houses until they got one. which sounds kind of crazy, but it was only, you know, 2 weeks worth of work. But I ended up I live in a house now, all to myself, so it's awesome. Wouldn't necessarily pick otherwise if I had to do it again.
For me personally, I think what did I do? First year I lived with roommates. So I lived with 3 other roommates. Second year I lived with 1 roommate. And then third year, I guess I just kind of had enough of dirty dishes and stuff. And so I ended up getting my own place, and I've stayed there ever since. And I think you find out what works for you. Obviously there's pros and cons to living with friends and stuff. And especially when you're all in the same program, it can be a good way to build camaraderie. At the same time, it's just the fact that if you're not used to living on your own, if you have to share a bathroom or things like that, that can be a bit of a learning curve. And so I guess honestly, I would recommend living both on your own and with by yourself, because quite often we're at a stage in our lives where we'll never get these experiences again. So whether you have a partner, plus or minus a dog, and you know, it's a time in your life where it's really up to you to kind of figure out what you want to do and how you want to live. And it's no better time to figure that out than now, I guess. You're spending a lot of time with your friends, and being able to go home with them and hang out even outside of clinical and school hours, I think is a good benefit for sure.
Great, thank you. We have time for 1, maybe 2 more questions, so I will try and pick one out for both of you. Actually, we have a good one here about if you're working, do you have a part-time job or anything, and just kind of balancing the student and social life?
So I'd recommend not having a job. I don't have I deliver Uber Eats on the side for exercise on my pedal bike, like an hour, 2 hours a week. Like it's not really a job. But anyway, the reason for it is, so we're paying $500,000 worth of, you know, expenses over the next 4 years. If you work part-time, you're going to make 30 grand, 40 grand. Like it's just going to be such a negligible part of your loan that you'll save. And by doing that, your grades will slip to some degree. Unless you have some job that lets you study at work, you're going to be giving something up to have this job. I know lots of people that hold jobs and they like it and they keep doing it. Some of them they can study at work, some of them they can't. Although I do know the only 2 people that I know in my program that failed out last year, both were working. So I don't necessarily want to blame it on that, but I just can't imagine you making a reasonable amount of money to counteract your just gigantic amount of student debt.
Nice, thank you.
Yeah.
In dentistry, it's very hands-on. There's a lot to know and a lot of clinical stuff that I feel like learning it from the books is not always sufficient. I think there's a nuanced way of practicing that just reading it off of the paper doesn't really get you far. So I've heard that dental assistants that work in Sydney, they're well compensated for sure. And on top of that, it's a good clinical experience to know kind of what you're doing, because it's one thing to know that you're supposed to do these steps and these orders, but to actually see a dentist do it and when it comes into play and when it doesn't come into play, there's a lot of nuances that, again, you just can't appreciate from reading a textbook or reading lectures. And a lot of my classmates do pick up a part-time job, just like on Saturdays, dental assisting for a local dental office. And unlike Canada, where you need to be registered to be a dental assistant, you can actually, anyone can be a dental assistant in Sydney,
Cool.
Which is interesting. So yeah, it's good money, good experience, good way to learn. But as others have said, I think it is definitely a crunch on your time, and you'll find that in both programs, medicine and dentistry, that you just don't have that much spare time to offer. So I do think that your grades do slip, but you make up for it in different ways. You get a lot of clinical knowledge that you wouldn't have had otherwise.
Yeah, no, I could see that if you had a job in healthcare, how beneficial that would be.
Mm-hmm. Sure. That was great. Thank you guys so much. Lots of awesome advice, and it's great to hear your experiences. I know you guys are very busy, so thank you so much for joining tonight, both Tyler and Dylan. So if you do have any more questions, feel free to head back to the Career Echo chat rooms. But otherwise, once again, thank you so much. We really, really appreciate it, and I hope you guys have a great rest of
yeah, no worries, guys. See you in Australia.
Have a good night, guys.
Sounds good. Thanks, guys.